virus pandemic. Now cases are rising across the continent. Many countries like South Africa are taking similar precautions as the rest of the world, cancelling international flights, closing schools and land borders. In Nigeria, Africa's most populous nation of nearly 200 million people, schools have shut and there's a limit to religious gatherings.
You can see the number of worshippers that were in the mosque today are not up to the 1/3 of the normal congregation due to our sensitization, talking to the people to understand the situation.
Mauritania's normally busy capital is quiet, with authorities imposing a nighttime curfew to encourage social distancing. Nations like the Democratic Republic of Congo have dealt with a health crisis before. The most recent Ebola outbreak there killed thousands of people. This time, its president is taking no chances, calling for bars and restaurants to close. But casual workers who don't earn a lot may lose their jobs.
No customer has come today, and there's no point in setting tables.
The ban on international travel and sports events is affecting people in Zimbabwe. Punters here say with sports games cancelled, fewer people are turning up to betting houses. And street vendors in this township say they have no choice but to work. Some are worried about what is to come.
We've had outbreaks of cholera, typhoid in the past years, and we've struggled to overcome those. And I'm just seeing the news around the world about how the US and Italy are coping with the coronavirus, and I'm not too sure if Zimbabwe is prepared for this.
With more than 20 cases reported in Cameroon, hospital staff in Douala are preparing for the worst. And demand for hand sanitizer is growing. But despite measures put in place to limit large crowds, some streets are still busy. Cameroonians are calling for tougher controls.
The government must take tough action against stubborn people. I'm a shopkeeper and I respect the standards. I try to keep things clean and avoid big markets.
In Kenya, health workers have been disinfecting local markets. But the World Health Organization says African countries need to do more to enhance their capacity to detect the virus early, isolate and track patients.